Sometimes the parents come to us with description of the poop. Remember, it's always helpful if you can take a click of the pic. The descriptions often vary. Some call it mucousy, gummy, and it's always a perpetual point of confusion. Now I'm going to just tell you briefly about what are the absolute signs that you must go to the doctor. Hello, I'm Dr. Lakshmy Menon. I'm a practicing neonatologist and paediatrician in Cloudnine Hospitals, Bangalore. Today, I'm going to be discussing with you all about the colors of the poop. Well, don't look shocked. It is very important, especially for new parents, to know what are the colors of the poop that a newborn can come up with, and you will be surprised at the range. So here is a simple thing. The baby starts to function its digestive tract only after the baby is born and starts to feed. They do a little bit of it even when they are inside, but nothing that you can observe, obviously. So when the baby comes out, starts feeding from the mother, the milk goes in, there is a lot of digestive processes which have kicked in. Now the baby starts to produce the poop now. So the initial 5 days almost of the baby's early neonatal days, actually the color of the poop is different, and then it transitions to different colors. So here today I'm going to take you through the different colors of the poop. Yes, we call it happily rainbow poop, if you must know that. And you will understand when to be alarmed, when not to be alarmed, and when do you actually need to go to the emergency right away. Most common color that we see obviously is the yellow color poop, which is normal, and breastfed babies actually have a bright mustard yellow colored poop, and this bright mustard yellow poop happens almost after every feed. And remember, this is not a loose motion or an illness. This is normal breastfeeding stools. You will find some of the babies poop up to 10 to 12 times a day, absolutely normal, no problems. The foremost color that we see is green. And the green poop is actually called meconium. Meconium is a part of the normal, bile of the baby's intestine, which comes out almost in the same way that it is. And the color of the poop is usually a dark green, almost blackish green color in the initial 5 days. Towards the 3rd, 4th, and the 5th day, we see it getting lighter and lighter in color. The third most important color of the poop that we need to know is the green colored poop. Now here is an interesting fact. The green colored poop, what I talked about earlier, which was the meconium thing which came out, that is normal. But when the green colored poop becomes green and frothy and multiple times in a day, more than 5-7 times in a day, or seems almost completely watery, that may be a sign of an illness. Sometimes these green frothy stools also happen when they actually are feeding a lot on the foremilk. What is foremilk? I hope all of you know what that may be. Is the initial part of the milk, which is more watery, higher in protein, and they do cause green colored poop. So in this case situation, all the baby needs to do is be fed on the same breast. It especially happens in babies when they do short feeds, and it looks like you're switching the breast from one to the other, but every time the baby is only getting the foremilk, and therefore the green colored poop continues. So in this situation, all we need to ensure is that once the breast is emptied, only switch to the other breast. So this is about the green poop, which is still normal but needs a little bit of tuning so that the baby doesn't pass any more green colored poop. We see sometimes is the orange colored poop. Orange colored poop usually happens because of casts or crystals, sometimes concentrated poop, and sometimes formula fed babies also have orange colored poop. It's more not orangey, it's more a darker yellow, which almost is bordering on brown, and that appears like orange, again normal, that's not a problem. Poop that we often see is red colored poop. Now that sounds ominous, right? Yes, it is sometimes ominous, but sometimes it may also happen when the baby swallows maternal blood because of a cracked nipple. A lot of new mothers don't know how to latch on, and sometimes the baby just sort of grabs on, and because of that there's a little bit of tear and cracks in the nipple. That leads to a little bit of bleeding. This blood almost continues undigested outside, and there are blood stains in the poop, and therefore that sort of becomes a point of alarm. But here the mother needs to be treated for the cracked nipples, and the latching technique perhaps needs to be relearned. That is all that it entails. But also a point to be noted that a blood in stool, if there are no cracked nipples, must be investigated for other things. For example, some of these babies have milk protein intolerance. When there is milk protein intolerance, or if the baby is a formula fed baby and the child has cow's milk protein intolerance, that may cause an allergic reaction which causes bleeding in the intestine and the blood appears intact in the stool. So that is a point of worry here. The pediatrician or the treating doctor will tell you, they will do some tests and they will tell you perhaps a tweaking of the formula or certain restrictions for the mother. Now, the most worrisome aspect for us are the white chalky stools. These are problematic. Usually white chalky stools means that the baby is not producing enough bile in their body, and that causes a lot of liver issues that may cause to failure to grow for the baby, and that is an absolute emergency which you must go to the doctor. The white chalky stools always mean that the child will be hospitalized mostly, will undergo investigations, and a point not to be ignored and waiting for the poop to turn color. No, the more time lost, the more difficult it is to manage the baby. So I urge all of you, if the baby is passing white chalky stools, please go ASAP to the doctor. So let's talk about what is normal. How many times is normal? How many times should a baby poop and we still don't have to worry? So here we know that breastfed babies almost pass stools after every feed literally. It can be as often as 6 to 8 times a day. Some of the babies who may be partly formula fed, even breastfed babies, sometimes don't pass stools up to 5 to 7 days. So the first instance when I talked about frequent pooping, so long as the baby's weight gain is good, this is not to be treated as an infection at all. So if the baby looks chubby, healthy, thriving, do not worry. This is normal stuff. The digestibility of the breast milk is so good that they pass poop almost immediately after every feed. If you think there is a problem, please keep a track record of the kind of poop. It helps to maintain a log if that helps. And there are apps which help you to do that as well, like Huckleberry and things like that. So please do look up on the internet about that. Last but not the least, if the baby has not pooped for more than 7 days, looks bloated, uncomfortable, doesn't want to be feeding, looks nauseous, absolutely go to the doctor. Your baby's poop can tell you more than you think, and now you know what is normal, what is not. For any more questions or clarifications, please subscribe to our YouTube channel at Cloudnine Care. We are happy to answer all your questions. Thank you.